All right, here we are. We're going to be doing 7 hip exercises. We're going to start off on the foam roller. So in terms of the lineup for the foam roller, if you find the top of your iliac crest, which is the top of your pelvis, you want to be just below that, okay? Not so far as to get onto the bone called your greater trochus. You're going to go right in that space in between, okay? You want your body to be nice and straight so that your ear is right on your arm. Your arm is your pillow, and your nose is lined up with your sternum, which is your breastbone there, okay? So now with flex feet, you're gonna raise that top leg up, and then you're gonna pick that bottom leg up to meet it. So bring that leg up, clap your feet, and lower down, okay? So keeping both feet flexed. That top leg is stationary, the bottom leg is moving. There's work happening both at that top leg and the bottom leg, using those inner thighs. Two more here. Good, now lower that bottom leg down, lower the top leg down. Keeping that top foot flexed, we're gonna move to number 2. So you're doing hip abduction. So you're lifting that leg up and then back down. You wanna lead with your heel and taking this hip. You wanna make sure that you're not rolled back. If anything, you wanna roll that top hip forward slightly. Most likely you're gonna need to tent that front hand, so lifting that leg up and then down. So you're getting a nice release on that bottom hip with the foam roller while you're strengthening the outside of that top hip. You want to be careful that your ribs aren't popping up. You can kind of pull those ribs down in the front. That can assure that your core is turned on. And then hold that top leg up. You want to bend that bottom knee and doing circles here. And that's 10. Reverse that. So you want that circle to be small and in control. And lower that leg back down. So now you're going to come off of that foam roller. And you're going to bend the knees, both knees. So if you look down, you want that ear, your shoulder, your hip, and your knee to be in one line. You want to gently lift up the bottom waist so that you create a little bit of a mouse hole there. Lift up and try to hold that up. Now you're going to tip both feet up. So both feet are up in the air here, and you're setting yourself up for clamshell. So with this clamshell, the feet stay together and you lift that top knee. So your body's going to want to come into like a C position, so make sure you keep yourself in that nice alignment. Again, the ribs are pulled down. I like to tent the front hand just so I can feel more stable. What happens with most people is that the front of the hip wants to help out, and to do so, you'll roll those hips back. So make sure that that hip is forward. If keeping the feet up in the air feels like it's just way too much work, you can lower the legs down and do clamshells like this. Knowing again that that front hip is going to want to tend to roll back, so keep that front hip rolled forward. You can even keep your hand right on that hip with your fingers in the front and your thumb in the back. You want to feel like the muscle underneath your thumb is doing the work. That's called your gluteus medius. And you want to keep the muscles in the front under your fingers quiet. So this is clamshell, and this is considered clamshell level 2 if you're going by the APPI guidelines. Okay, so either one is beneficial, but again, you have to know what you're working. You want to feel this in the corner of your seat or your upper glute. You do not want to feel this in the front. So lowering the legs down. Again, you're keeping that nice line with your ear, your shoulder, your hip, and your knee. And you want to do what's now called reverse clamshell. So the knees stay together and the foot comes up. So where you should be feeling this is in the hip joint itself. So we're working the small rotators of the hip. And this one does not feel as satisfying as the others. You're just working very small muscles, but trust me, they're worth working. An alternative for this one, if you want a little bit more work, is to make your way up onto your elbow here and lift the hips up so you're in what's called side bridge, and then doing the reverse clamshells here. So the range of motion is less important than what muscles you're using. Again, this is called reverse clamshell with the addition of being in that side plank position. And then last but not least, you're going to come all the way down flat again. Extend your arm as your pillow, keeping that nice alignment of the ear, the shoulder, the hip, and the knee. And then take your hands, put them on your ribs. Make sure that those ribs are tucked down so that you're not popping your ribs, thus arching your back. And the last one is a fire hydrant. So again, you can put your hand on your hip and lift that leg up and then back down. So with that bottom knee bent, you're going to feel more stable than if that bottom leg is straight. So just like the rotator cuff is important for the shoulder, these small hip rotators are really important for the stabilization of your hip joint. In terms of number of reps, a good place to start is 10 of each of these. Good, and then after those, you want to roll onto your back and make sure that you do a figure 4 stretch. So the figure 4 stretch, you're going to take your foot rested on your opposite knee and weight shifting side to side. Finding those areas of stickiness. Maybe grab that thigh, bring that thigh up, bring the knee in towards the chest. Other variation is to straighten that leg. And then lower that foot back down. Good, obviously doing this on both sides. If you have a weaker side, I would suggest that you always do the strengthening exercises on the weak side first. If you're sore the next day, give it a day's rest. If you're not sore, you can do these every day. Again, working on the small stabilizing muscles of your hip. Good luck.